I was diagnosed with prostate cancer in April 2009.
When you first hear the word cancer, your mind goes blank. You can't think of anything else except cancer and death. And then after a while, we start talking about what we can do about it, what processes were available, and then he mentioned HIFU.
According to the National Cancer Institute, each year more than 215,000 men will be diagnosed with prostate cancer, and over 30,000 men will die from the disease.
I went for my annual physical here in Grandma with my family doctor.
Most men are diagnosed early and have many treatment options that may be effective in destroying the disease.
I had this call from the doctor. He never calls, and I was surprised. He asked me, did I have a urologist? I said, no. He said, well, I'm going to make you an appointment to see one. And I went over for the biopsy, and 6-7 days later, the results came back and they were positive. He said I had prostate cancer.
The first thing I tell them is, it's unfortunate that I have bad news to tell you, but you're very lucky because today, 2010, we have non-invasive therapies that are equivalent to other treatments, equivalent to surgery, equivalent to radiation, and without the risk and side effects that are associated with surgery and with radiation.
If a patient is diagnosed with prostate cancer, I discuss their disease with them and their treatment options. The standard treatment options in the U.S. are radiation, surgery, and watchful waiting. I also mention as an alternative HIFU as a less invasive treatment method.
HIFU, which stands for High-intensity Focused Ultrasound, is a minimally invasive procedure that is non-surgical and radiation-free. HIFU is a new therapy option that uses focused sound waves to heat and destroy cancerous tissues.
HIFU is to sound waves what lasers are to light. We use lenses and mirrors to concentrate light into a pinpoint laser beam, and everybody knows what that is. You can imagine. HIFU is fairly similar in that we can concentrate the sound waves, which pass through the body harmlessly under normal circumstances, into a pinpoint, very accurate beam that can essentially get very hot and destroy cells, particularly cancer cells. It's beneficial because we can penetrate through important structures and preserve them and target and destroy only what we're after, minimizing surrounding or collateral damage.
Unlike radiation, HIFU uses clean or non-ionizing energy, so the procedure may be repeated if necessary.
We discussed different treatment options. One of those was chemotherapy, radiation, and the seed implants. But based on pre-existing conditions that I have, he said those were not a good choice for me because they would cause side effects.
It's extremely effective. Patients are selected patients with generally low-risk disease confined to their prostate gland, and it's provided an equal cancer result as far as the alternative therapies that I offer, but with far less quality of life change.
Sonoblate HIFU, performed with the Sonoblate 500, is minimally invasive, is performed on an outpatient basis, and typically lasts 2 to 4 hours depending on the size of the prostate. There is no surgery or radiation involved.
Right after the procedure, really, I was ready to go and go back to the hotel and find some food.
During Sonoblate HIFU, physicians obtain real-time ultrasound images of the prostate and surrounding areas. From these images, they can create a customized plan for delivering the ultrasound energy. The Sonoblate software allows physicians to precisely define the treatment zones in order to treat all cancerous tissue in the gland. One of the newest features on the Sonoblate is called TCM, or Tissue Change Monitoring, which gives real-time feedback to the physician regarding changes in tissue both before and after HIFU was delivered. TCM gives the physician immediate visual confirmation about the amount of energy that is delivered to the prostate to ensure all tissue is fully treated. HIFU is currently undergoing clinical trials for FDA approval in the U.S., but is available outside the U.S. in more than 30 countries worldwide. Nearly 400 urologists have trained on the Sonoblate, and more than 9,000 patients have been treated worldwide.
Some people look at HIFU and consider it experimental. It's far from experimental. There's lots of data from many, many years of follow-up. It just hasn't gotten through the bureaucracy and the red tape of a government agency, namely the FDA in the United States. Really, it's just a matter of a political issue in terms of the approval process. We do have many years of data and experience with HIFU, and we know that it works.
Patients who explore all their options and decide to have HIFU may choose to travel outside the U.S. to Canada, Mexico, the Bahamas, or Bermuda for the procedure.
I wasn't nervous at all about traveling out of the country. Anybody that does any travel these days, it's just a regular flight. And the wait's not long at the custom office, ask a few questions, what you're here for, and moved right through.
We drove to Savannah, Georgia first, flew from Savannah to Charlotte, and then Charlotte to Bermuda, 2-hour flight, unbelievably simple to do. And as you're coming into Bermuda, you see the gorgeous water off the coast. So just coming in here was a great experience. Then there was a driver to pick me up, and my wife, and our bags, took us right to the hotel.
I'd never been to such a gorgeous hotel in all my life. I could visit that hotel any day of the week and every month. It was that beautiful.
The process for doing it was so laid out perfectly that it was all ease. You come in, I checked into the hotel. Robert, the nurse from North Carolina, called me, told me where to be, walked down to the lobby, and I was walked through every process.
Once the patient arrives at the treatment location, the nurses facilitate for the patient. So we meet the patients, we meet with the patients with the patient education the night before their treatment, talk them through everything they should expect for the next day and the next couple of days post-treatment. We are available to the patient 24 hours a day on call if the patient needs us.
And then we'll have our driver once again pick them up the day of the procedure and their family members and take them to the hospital. They will meet in a pre-op area with the local nurses there. The procedure usually lasts between 2 and 4 hours, and the recovery will last between 3 and 4 hours. So the patient's usually at the hospital for the entire day.
From start to finish until I got back to the hotel, Robert and Dr. Johnson checked them, make sure everything was fine. It was simple.
I was worried about the facilities outside of the United States. Used to be the United States was the #1 place to practice medicine, but now all these other countries are having better doctors, and they're having just if they're not as good as or better than we have in the United States.
After they wake up from the procedure, our driver transports our patients back to their hotel where our nursing staff and the physician staff is staying. There's rarely any difficulties at all, but patients can be assured that we're on site with them during the recovery process.
Dr. Jackson dropped by my room last night, asked how I was doing, check up on me, and Robert Johnson, he's been very helpful and friendly.
Those guys are great. I felt like, as I told you before, that I felt like I was one of their brothers.
Is HIFU right for you? The answer lies in your current condition and other factors. First, discuss all available treatment options with your physician. Then, if you feel HIFU is right for you, call today for more information and a full consultation.
I did a lot of research, but I didn't find anything that showed me a better option.
Now I've done it, I'm going to say again, I'm sorry I didn't just come by boat, and I could have brought my boat here.
Well, HIFU was great for me because it's cured cancer. For me, it was the only choice, and it was the best choice.
If people knew how simple it was to go through this operation, I'm sure they would choose it, and I would highly recommend it.